Good morning, my name is Roberto Ramirez and I'm going to be your nurse today, ma'am. Can you please verify your name and your date of birth?
Adriana Franco, May 26, 1978.
Okay. Do you know where you are?
I'm in the hospital of Providence.
Do you know why you're here?
I'm here to get a health assessment.
Okay. Do you know what year it is?
It's 2023.
Okay. Patient is alert anointed times 4. It's to person, place, time, and situation. Okay, ma'am, do you know what you did last Christmas?
I was home with my kids.
Do you know what you did yesterday?
I went to the grocery store.
Okay, so patient's short-term and long-term memory is intact. Okay, ma'am, what would you do if your car broke down in the middle of the street?
I'll call my sister or a friend to come and help.
Okay, so patient's abstract reasoning is intact. Thank you so much, ma'am. Okay, ma'am, so today we'll be performing a physical examination. Is that okay?
Yes.
Okay, so during our assessments today, I'll be palpating some of your facial features and some of your abdomen, and we'll be exposing part of your abdomen. Is that okay, ma'am?
Yes.
Okay, ma'am. So we'll be beginning our assessment today with the head and neck. Okay, so I'm going to be looking at your face. I don't see any asymmetry. I don't see any lower lid droop. Patient's skin is appropriate to patient's age and ethnicity, and no abnormal involuntary movements noted. Okay, ma'am, so can you please raise your eyebrows? Can you frown? Can you smile? Can you show your teeth? Puff out your cheeks? Okay, so that is cranial nerve number 7. Patient's cranial nerve number 7 is intact. Okay, so can you please close your eyes, ma'am? We're going to be testing for sensory notion of your face.
Yes.
Okay. Tell me where I'm touching.
My left cheek. Right.
Okay, so patient's cranial nerve number 5, trigeminal, is intact. Okay, so now I'll be inspecting your hair, ma'am. Is it okay if I touch your hair?
Yes.
Okay. So I'm inspecting the hair for any abrasions, any lesions, any signs of alopecia or pediculosis. Patient's hair is evenly distributed throughout her scalp. No abnormalities noted upon assessment. Thank you, ma'am. Now I'll be examining the patient's eyebrows. So eyebrows are evenly distributed throughout. No scaling is noted. Patient's eyelashes are evenly distributed throughout. Okay. So now I'll be examining your skull. So patient's skull is cephalic, normal cephalic, with no lumps or abnormal bumps noted upon assessment. Okay. So now I'm going to be palpating your cervical lymph nodes, ma'am, which will be part of your neck. Okay. Tell me if it hurts.
No.
No? Okay, so cervical lymph nodes are unpalpable with no tenderness noted upon palpation. Okay. I'm going to be examining your trachea, ma'am, for any deviation. Okay, no deviation noted. I'm going to listen for breath sounds. Okay, and breath sounds are present on the patient's trachea. Okay, now I'm going to be examining your thyroid gland. Have you ever had any problem with your thyroid gland?
No.
No? Any family history? I'm gonna gently palpate.
No.
No? Okay, so patient's thyroid gland is centered midline, no deviation noted, no abnormal lumps noted upon palpation. Okay, ma'am. Are you able to swallow? Do you have any difficulties?
No.
Okay, so patient's cranial nerve number 9, glossopharyngeal, is intact. Okay. So now I'm going to be using a Snellen chart to be testing for the patient's visual acuity. Okay, ma'am. So I'm going to be holding a Snellen chart, and I'll be posting it here in the wall, and I'll let the patient sit right here. Stand up right here, and you'll be covering your left eye first and letting me know what letters you're reading.
E F P T O Z L P E D P E C F D E D T C Z P F E L O P Z D D E F P O K E R.
Okay. Now your other eye, please.
E F P T O Z L P E D P E C F D E D F C Z F F E L O P Z D D E F P O T E C.
Thank you so much, ma'am. So your visual acuity is 20/20 upon the Snellen chart assessment. Thank you, ma'am. Okay, so I'm going to be assessing the patient's eyes. Okay, so no protrusion or deviation was noted upon assessment. Patient is looking directly at me. Okay, so I don't see any edema noted here in the patient by the patient's eyelids. Patient's eye color is appropriate to patient's age and ethnicity. No lesions noted. Patient is able to close her eyes with no tenderness noted. And her eyelids and eyelashes are full and well distributed throughout. Okay, so now, ma'am, I'm going to gently pull your eyelid down, and I'm going to be assessing your lacrimal apparatus and your conjunctiva. Okay. Okay, so patient's conjunctiva is pink and moist, sclera is white, iris is brown, with no abnormal discharges noted upon assessment. Okay, now I'm going to be inspecting the pupils for size and symmetry. Can you please let them like it? Okay, they're bilaterally correctly aligned. Now, ma'am, can you please follow the pendant? Okay, so patient is able to move the direction with the pen light. So cranial nerve number 3 is intact, and cranial number 2 optic is intact. No abnormal symmetry noted, no nystagmus noted. Okay. Now I'm going to be assessing your ears, ma'am. So I'm going to be whispering a word in your ear, and you're going to let me know what I just said.
Black. Brown.
Okay, so patient was able to identify the phrases that were whispered in her ear. So cranial number 8, vestibular cochlear is intact. Okay, so in the clinical setting, I will be using a tuning fork to perform the Rini and the Weber test. So I would be assessing the patient's hearing. Okay, ma'am. So I'm gonna simulate that I have the tuning fork. Just let me know whenever you stop hearing.
No.
Okay. Now I'm gonna do it on this here. Excuse me. Tell me when.
No.
Okay. So if air conduction is more than bone conduction, that identifies that the patient is able to hear with no problems, and no hearing loss is noted. Okay. I'm going to be inspecting your ear now. Okay. Okay, now I'm gonna put this instrument inside your ear and I'm gonna be inspecting. Okay, so patient's right tympanic membrane is shiny and pearly gray. No abnormal lesions noted. Patient's left tympanic membrane is shiny and pearly gray with no abnormal lesions noted. Thank you. Okay. I'm going to inspect and move your jaw, ma'am. I'm going to be can you please clench your jaw? Okay, from side to side. Okay, no crepitus was noted and no abnormal lesions noted upon the masseter muscle. Okay, thank you. Okay. So I have okay, so can you please close your eyes? Can you please identify the smell?
Alcohol?
Okay. Thank you. Patient is able to identify the smell, and cranial nerve number 1 is intact, which is the olfactory. Now, ma'am, I'm going to be inspecting inside of your nose and the anterior and inferior surfaces of your nose. Okay, no polyps were noted, no abnormal discharge noted. Patient's nose is aligned symmetrically with no asymmetry or abnormalities noted. Okay, now I'm going to be palpating your frontal and maxillary sinuses. Do you feel any tenderness, ma'am?
No.
No?
No.
Okay, so patient's frontal and maxillary sinuses are intact with no abnormal tenderness noted upon palpation. Okay, so now I'm going to be inspecting your mouth now. Okay, so patient's lips are moist, pink, no dryness noted, no lumps or ulcers or cracking scaliness of the lips noted. Okay, so I'm going to be inspecting the oral mucosa. Can you please open your mouth? Okay, thank you. So, can you please pull out your tongue? So, uvula is centered midline, no abnormal discharge noted, no bumps or lumps noted. Teeth are evenly distributed and patient has no missing teeth. Okay, so oral mucosa is pink, no abnormalities noted. Okay, so patient's hard palate and the floor of her mouth were pink and moist, and no discoloration or nodules were noted. Okay, ma'am, can you please stick out your tongue and then put it side to side? Okay, so patient's cranial nerve is number 7. Hypoglossal is intact. Patient is able to move tongue in opposite directions. Okay. I'm gonna inspect your mouth again now. Okay, are you able to swallow now? Okay, can you please open your mouth again? Okay, so I'm looking for any lesions. Patient is able to swallow. Patient's soft palate is pink and moist with no abnormal lesions or polyps noted. cranial nerve number 10, vagus nerve is intact. Have you ever had any your tonsils removed?
No.
No? Okay. I'm gonna assess your tonsils and your pharynx. Okay, can you please look at your tongue? Okay, so patient's tonsils are intact and pink and no abnormality exudate noted. Okay. Patient is able to swallow. Uvula is central midline, so cranial nerve number 9 and 10, which is a glossopharyngeal and vagus nerve, are intact. Okay, ma'am, I'm going to let. Can you please repeat this phrase?
Yes.
Okay. The dog went outside and came back.
The dog went outside and came back.
Okay, so patient speech is articulate and clear. Voice quality is clear. So cranial nerve number 5, trigeminal, is intact, and cranial nerve number 7, which is facial, is intact. Number 9 and number 10 and 12, which are the glossopharyngeal, vagus, and hypoglossal cranial nerves, are intact. Okay, so now we'll be moving on with our assessment with the neuro. Okay, so first I'll begin my assessment by noting any abnormal movements in the patient's muscles. I don't see any abnormal movements. Patient is able to sit still with abnormal or involuntary movements noted upon inspection. Okay. So I'm going to be assessing for your sternocleidomastoid. Okay, can you push against my resistance, ma'am? Okay. Now can you do this? Okay. Push against my resistance. Are you able to shrug your shoulders? Okay. So patient's cranial nerve number 11, accessory cranial nerve, is intact. Patient is able to move on manipulation of resistance with the shoulders. Okay, C5 and C6, the deltoid muscle, is intact. Patient is able to actively move against full resistance. Okay, so now, ma'am, I'm going to make you flex your elbows. Can you please flex your elbows? Okay, and then extend, and then pronate, supinate. Okay, C5, C6, biceps and brachioradialis is intact, with extension C6, C7, C8, and triceps. Okay, ma'am, now I'm gonna make you do this, then move pronate, supinate, and then move up. Okay, so patient's extension of the triceps away from the core is intact, C6, 6, 7, and C7, C8. Now I'm gonna make you move your wrist, flex your wrist, extend. Okay, so patient is able to have full range of motion in her wrist, which is assessing for C6, C7, C8, and the radial nerve and extensor carpi radialis, longus, and brevis is intact. Are you able to extend your fingers, ma'am? No tenderness? No? Okay. So patient is able to extend her fingers. So C7, C8 radial nerve extensor digitorum is intact. Are you able to adduct and abduct your fingers, clench your fist, and then move them like this? Okay, and then finger tap. Okay, so patient is able to move it to abduct her fingers, adduct. So C8T1, the ulnar nerve, is intact. Are you able to put a thumbs up on both? Down? Up? Okay, so thumb abduction is intact with assessing the patient's C8 and T1, which is the median nerve of Dr. Pollices brevis. Okay, now we're going to stand up. I'm going to be assessing for your hip flexion. Okay. So I'm gonna have you move your leg forward, your right leg forward. Now the other one. Then sideways. Sideways. Okay. So that was testing for patient's hip flexion. Patient is able to have full range of motion in her hip flexion, which is assessing for L2, L3, L4, and patient is able to extend gluteus maximus by moving her leg forward, up and down. Okay. Now can you please move your knee? Can you please extend your leg? Okay. Flex. Now the other leg. Extend. Flex. Okay, so patient is able to move her knee. I'll be assessing for crepitus. Do it again. Okay. Up. Down. Okay, no crepitus noted upon assessment. Okay. Now we're gonna be assessing the ankle dorsiflexion. Okay. So can you please extend your ankle? Extend, flex, move sideways. Okay, no crepitus noted on the patient's left ankle. Okay, extend, flex, sideways. Full range of motion in the patient's ankle with no crepitus noted upon palpation. Okay, so that was assessing for ankle dorsiflexion, the L4 and L5 tibialis anterior. Okay. Now, can you push against my foot? No, with your feet. Okay, push. Thank you. Okay, now can you pull down? Okay. So patient is able to have flexion of her plantar. Now we're going to be assessing for coordination by alternating movements. Okay, can you move your arms forward, backward? Okay, and then finger tapping. And then can you put your finger to your nose? Okay, thank you. And then heel to, now can you put your heel in your chin, like this? Yeah, okay. Okay, so patient has range of motion in her lower extremities and is able to perform the finger to nose test and heel to shin test. Now we're going to be assessing your gait. So I'm gonna have you walk in a straight line. Okay, on a straight line. Now walk forward. Okay, so patient gait is balanced. One normal movement noted. Now can you walk on your toes, ma'am? Okay, and then back. Okay, can you walk in your heels? Okay. Thank you. So patient was able to walk with no abnormal imbalance and coordinated movements with heels to toes. Okay. Patient gait is balanced. Okay, ma'am, are you able to can you close your eyes? Okay. Do you know where you're touching?
My arm?
Which arm?
Left.
Okay.
Right arm.
Okay, so patient has full sense of light touch. I'm gonna put something in your hand, and you're gonna let me know what it is.
It's a bottle. Water bottle.
Okay, thank you so much. You can open your eyes. Okay, so patient's diagnosis. Patient is able to identify objects placed in her hands. Diagnosis is intact. Okay, so now I'm going to be assessing eliciting stretch reflexes. So I'll be begin with with your biceps. So can you please just okay. Okay. Just relax. Okay. So bicep reflex is intact. C5, C6. Patient is able to reflex on extensions of the forearm. Now I'll be assessing for patient's triceps. Tricep reflex. Okay, so patient's tricep reflex C6 and C7 is intact. Now I'll be performing the quadriceps patellar reflex. So can you just put more? Thank you. Okay, now. Okay, so patient's patellar reflex is intact. Now I'll be assessing the patient's Achilles reflex, which is primarily S1. Okay, so patient's Achilles reflex tendon is intact. Now I'll be continuing my assessment today with the thorax and lungs. Do you smoke now?
No.
Any respiratory medical problems that you have?
No.
Such as asthma, emphysema?
No.
Okay. Patient is able, upon assessment, is able to have normal breathing, no effort in breathing or signs of respiratory distress. Okay. So there's no abnormalities in patient's chest or muscle retraction or bruising. Okay. In the clinical setting, I would have my patient expose their chest to see any abnormal bruising, any abnormal retraction, which could be indicative of respiratory failure, such as people with emphysema, chronic obstructive pulmonary disease, or asthma. But I don't see this in my patients. Okay. So I'm going to be auscultating your bright sounds, ma'am. Can you take a deep breath every time my stethoscope touches your chest, please? Under your breath. Can you please lift up a little bit your breath? Thank you. Take a deep breath. Posterior. Okay, so patient's lung sounds are clear, no crackles noted upon auscultation. They're clear in all 4 lobes. Okay, so now we're going to be examining your cardiovascular system. Okay, so I'll be auscultating the patient's carotids one at a time. Okay, no bruise noted. Okay, now I'm going to listen to your heart. S1 and S2 noted upon auscultation with no S3 or S4 or bruise noted. Oh, okay, so I'm going to palpate your point of maximal impulse now. Is that okay with you?
Yes.
No tenderness?
No.
You don't feel tight chest?
No.
Okay. Okay, so I'll be continuing my assessment today by doing the abdominal assessment. Continuing my assessment, I'll be assessing the patient's abdomen. Okay, ma'am, so when was your last bowel movement?
This morning?
Have you had any recent diarrhea,
No.
vomiting, or
No.
nausea?
No.
No? Okay. Any problems in your stomach, ma'am, recently?
No.
No? Okay. So I'll be having you lay down then, please. I will have you expose part of your abdomen, if that's okay with you. Okay, thank you. So I'm inspecting the patient's skin. Skin is appropriate to patient's age and ethnicity, and no distended abdomen noted, with no stray noted upon assessment. Okay. So first I'll begin with listening to the patient's bowel sounds. Okay, bowel sounds are present in all 4 quadrants and they're normal active. Okay, so now ma'am, I'm going to be lightly palpating your abdomen, just to know for any tenderness. Let me know where it hurts. Did you feel any tenderness?
No.
No? Okay, so patient denied any pain or tenderness upon live palpation. Now ma'am, I'm going to be deeply palpating your abdomen using my 2 hands. Okay? Let me know where it's tender. Do you feel tenderness?
No.
Okay, so patient denied any tenderness upon palpation, no masses were noted upon palpation. Okay, so now I'll be percussing. So I'll be gently tapping your abdomen. Tympanic, 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 do, tympanic, tympanic, do, tympanic, tympanic, tympanic. Okay, normal findings were noted upon percussion. Okay, thank you so much. So patient does not show any signs of peritonitis. Patient is not guarding, or no rebound tenderness was noted upon palpation. Okay, no rebound tenderness noted, so negative for peritonitis. Okay, so now I'm going to be continuing my assessment, measuring the size of your liver, ma'am, along your midclavicular line by percussion.
Yes.
Let me get my ruler. Okay, so I'll be using a ruler to assess the patient's size of her liver using percussion method. approximately 7 centimeters, so it's within normal ranges. Okay, so patient's liver size is approximately 7 centimeters, which is a normal range for a female. Okay, so I'm gonna go ahead and palpate your liver now. Let me know if you feel any tenderness. No tenderness now?
No.
Okay, the edges are palpable with no tenderness noted upon palpation. Okay, thank you. Okay, so I'll be continuing my assessment today with the spleen, assessing the patient's left upper quadrant and percussing for any splenic enlargement along the trach space. Okay, so patient's spleen is dull upon percussion with no tenderness noted upon percussion. Okay, so I'm going to be continuing my assessment today, assessing your kidneys, ma'am. So if I can just have you sit upright now, please. Thank you for your cooperation. Okay, so I'll be gently using my fist like this, and I'll be tapping my fist to percuss for your kidneys.
Okay.
Okay. Any tenderness?
No.
Okay, no tenderness noted with resonant noted upon percussion. So now we'll be following with our assessment today by inspecting your shoulders. So I'm gonna go ahead and palpate your shoulders. Does this hurt?
No.
So no deformities noted, no tenderness noted, with no nodule noted. Okay, can you able to extend your arms? Okay, laterally, backward, forward. Okay, full range of motion in the patient's shoulder with no nodules, deformities noted in the shoulders, with no crepitus noted. Okay, so that we're going to do exercises now. So I'm gonna have you extend. Okay, now up, down, and then laterally. Okay, now forward. Can you do forward exercise? And then backward. Okay. Backward. Okay. Do you feel any discomfort?
No.
No, so no discomfort was noted upon assessment. Patient has full range of motion in her shoulders. Okay, so now we're going to be inspecting the elbows. Okay, so I'm going to be inspecting the contours of the elbow with the extensor surface of the ulna. Okay. Can you? Okay. No crepitus was noted with no swelling or nodules noted. Okay. Then no nodules or swelling noted, no crepitus noted. Okay. I'm going to be assessing for your range of motion in your elbows, ma'am. So I'm gonna have you flex like this, then extend, then pronate, supinate. Okay, so full range of motions of the elbows with no tenderness noted upon assessment. So now we're going to be assessing your wrist and your hands. Okay. So patient's nails are pink and no abnormalities noted upon assessment. They're normally symmetrically aligned to patient's arms. Okay. Okay, ma'am. So now we're gonna be assessing your range of motion of your wrist. So are you able to turn circles? Then upward, backward, forward. Okay. So patient has full range of motion in her wrist. I'm going to be palpating for any signs of crepitus. Okay, no crepitus was noted. No crepitus was noted, or nodules or swelling noted on both wrists. Okay, and patient is able to have full range of motion with flexion and extension, adduction and abduction of the wrist with no ulnar deviation noted. Okay, now I'm going to be assessing your fingers. Can you please flex your fingers? Extend, flex, forward, backward. Okay, so patient is able to flex and extend her fingers with no discomfort noted. Okay, now we're going to adduct and abduct the fingers. So can you please clench your fist? Then separate. Okay, so I'm assessing for any ulnar deviation which wasn't noted upon assessment. Okay, so now I'm going to be assessing the patient's spine. Okay, so can you please lean forward? Please. Okay, so I'm assessing the patient's spine for any signs of scoliosis, which patient's spine is aligned vertically with no abnormal curvatures. Okay, thank you, ma'am. Okay, so now I'm going to be assessing your range of motion of your cervical spine. So I want you to move your shin up and down, side to side. Okay, now put your ear in your shoulder. Okay, so patient has full range of motion of her cervical spine. Now are you able to lean side to side? Okay, so patient is able to have full range of motion in her thoracic spine. Okay, now can you please lean backward? I'll be supporting your back. Do you have any problem?
No.
Okay, so patient is able to have full range of motion of her lumbar spine. Okay, now we'll be inspecting the hips. Can you please walk forward now? And then backward. Okay, thank you so much, ma'am. So patient's gait is intact with no abnormal posturing noted or no spasms noted upon patient's gait. Okay, so I'll be assessing your hip now. Okay. Are you able to kick? Okay, and then do this. Okay, and then walk forward. Do you have any discomfort?
No.
Okay, so patient denied any discomfort for range of motion. And then can you do side to side? Forward, okay, upward and backward. Okay, so no discomfort noted upon assessment with no crepitus noted. Okay, so now I'll be inspecting your gait again to see your knees. So can you walk forward now? Walk backward. Okay, patient is able to walk and knees are intact. Okay, can you please sit down? Kick, kick. Okay, so no crepitus or tenderness, nodules or inflammation of the knee joints were noted. Do you feel any discomfort?
No.
No pain?
No.
Okay. No bruising was noted in the clinical setting. I'll be examining the patient's skin for any bruising, for any bumps or lumps noted. Okay, so patient has full range of motion of her knees. I'll be inspecting your ankle, ma'am, and your feet. Okay. So in the clinical setting, I would have my patient have her socks taken off so I can inspect her feet to to note any deformities, any nodules or swelling, calluses or corns. So this patient is negative for any calluses, corns, or deformities. Okay, so can you please move your ankle forward, backward? Okay, then sideways. Are you able to push? Okay, push against my resistance. Okay, so patient's strength is 5 out of 5 in her ankles and feet with no discomfort noted. Okay, that concludes our assessment today, ma'am. Thank you so much for participating. Do you have any questions, comments, or concerns?
No, thank you so much.
Okay, thank you, ma'am, for your time. Thank you so much for everyone watching this video. I really appreciate it.